Well, welcome to Modern Prescription. My name is Dr. Deepak Dugar. I'm a facial plastic surgeon in Beverly Hills.
I'm Dr. Jeff Toll. I'm a concierge internal medicine doctor in Beverly Hills as well.
And today we're going to be taking you through a lot of our favorite topics. We're going to start with telemedicine.
We talk about some weird stuff today. Coronavirus, masks.
Concierge medicine, aesthetics, drive-through botox.
This is one of the weird things is why when I'm doing a telemedicine visit, does my chin look funny on the Zoom phone call?
How to find the right doctors.
So,
COVID testing, swab, antibody, what's the difference?
It's all confusing.
Yeah.
And so we're here to answer a lot of commonly asked questions today.
Yeah, and then we'll get down to celebrity endorsements. What do they mean? And as a patient, does that mean anything?
I think they're weird.
Let's talk all about it.
We'll talk about it more.
Thank you for tuning in. We look forward to enjoying today on The Modern Prescription. All right. Well, this is our first episode, and welcome to Modern Prescription.
Glad to be here.
My name is Dr. Deepak Dugar.
I'm Dr. Jeff Toll.
And we are going to be giving you insights onto the modern look of medicine and how we kind of view things a little differently than our mentors and teachers did in the past. And even today, our practices continue to evolve. So I'm a facial plastic surgeon here in Los Angeles and Beverly Hills.
Very big one.
Thank you. I'm working my way up and it's going well. And I have a very elite practice with rhinoplasty. I just do nose jobs. It's kind of weird and funny that I just do one procedure, but it's allowed me to really become really good at it. And I get patients from all over the world now.
I think people don't realize that because you're focusing just on noses, you have more reps. You're just so focused on it and just so up to date on all the newest techniques. And I think that's really what makes you so special at what you do.
Totally. Thank you so much. And I agree. And it's the reps, like you said, it's the number of sets I'm putting up. My colleagues, my friends who do breast and facelifts and tummy tucks and eyelids, they're doing 5 or 6 a month of each of those. I'm doing 30 to 40 noses a month only. And so, end of the year, I'm doing about 10 to 20 times the number of noses anyone else is doing. But anyways, it's the repetition of muscle memory and just getting really good at one thing. And then that has allowed me to obviously have access to meet some of the best doctors in town as well, which is how I met Dr. Toll, who's my personal private physician and one of the best concierge primary care medicine doctors in the world, and definitely the top doctor in Los Angeles. So tell us a little bit about you, Jeff.
Did you just break your own HIPAA by telling everyone that I'm your doctor?
I did. I absolutely did. But it's okay. This is a waiver on air. I'm letting everyone know I'm my medical doctor.
So I appreciate that. So I just, when I was deciding how to start my practice, I just really felt that the way medicine had become in the last 20 years just wasn't the way that I wanted to treat my patients. People go to an office, they're in a waiting room. It's like a mill. You come in and out. The doctor's in for 10 minutes, waves her hand at you and walks out. And there's no real, you've lost that relationship. Like you used to have your doctor that the whole family knew. Your parents were seeing the same doctor. Everyone trusted their opinion, recommending what other specialists they see. And it just became this mill where your primary care doctor, quote unquote, would just kind of like take the 5 minutes and then just send you to a specialist, not even deal with you.
Yeah.
So the way my practice works is really the exact opposite of that. So we are really taking time to get to know people, be proactive. I know a lot of people, I take care of the whole family. If anyone is seeing a specialist, I'm calling the specialist on the phone to explain the situation before they get there, and then following up with them after the visit and following up with my patient again after the visit. There's a closed loop.
Right.
And so instead of like 10 cooks in the kitchen, no one knows, what's happening. It's just really able to be more proactive, get to the bottom of, a lot of people's medical problems are really, underlying depression, underlying family trauma, underlying all these things that unless you get to that, you'll never fix their diabetes. You'll never fix these other things. And so I found that to be a really important part of how we heal people. And I think you do the same thing in your practice.
Absolutely. And I felt like that even as a patient in your practice, the holistic approach that you take, looking at things from every aspect rather than just trying to treat that singular problem. And I appreciate that a lot as a patient and as a physician even more, because you realize how rare it is today in medical school and in training. And today as a patient in the world, depending on the problem you have, the first thing you think of is which specialist do I see? Because you kind of lost a little bit of faith, I would say, in the primary care system.
Yeah.
Primary care docs are just, kind of triaging to the specialist. And I think that's a lost art that it's really nice to see a young doctor like yourself take back in LA. Yeah,
it's funny, the internist, the guy who's supposed to be able to diagnose and figure out everything, that's been lost.
Yes.
And so, for myself, I take care of my own patients in the hospital. I don't use a hospitalist. I make house calls and see my patients. So it's the person that you know and trust that's taking care of you when you're healthy, when you're sick, preventing. So that I found, is just the better way to go. So
yeah. And you guys can't see it, but Jeff has one of the coolest home call doctor bags that you've ever seen. It's like reminds you of like the 1960s when the doctor would come to your house and take care of your whole family. I love it. I think it's so cool.
I try to crack people up.
Yeah, it's so cool. But yeah, you're right. I take a very different approach with my practice too, in the sense that, the average plastic surgeon, especially in Los Angeles and Beverly Hills, it's all about, what's your problem? How do we fix it? What's your problem? How do we fix it? And I kind of stepped back from that. I would say I'm one of the few plastic surgeons who's kind of anti-plastic surgery.
Yeah.
I say no to almost 40 to 50% of my consults.
Really?
We actually did all my data last year and looked at all my patient data. I turned down 45% of my consults last year. Just said no. Because they either don't need surgery at all. I just thought they were pretty. Most people just don't appreciate how good looking they are.
Yeah.
I think all of us are so much better looking and prettier and have more confidence than sometimes we realize. So one, I turn them down because they don't need surgery. And two, I turn them down because I'm not the right surgeon for them. And I'm super honest about it. And I think that that's another lost art with doctors today is there's this ego that we all have, understandably, but it doesn't do justice to the patients.
What does that mean exactly, not the right surgeon?
So there's different types of surgeons for different types of needs. And everyone thinks a nose job's a nose job or a boob job's a boob job. Or, if you're getting a gallbladder out, a gallbladder. It doesn't matter who it is. It's not. There's so many nuances to it. And so within nose jobs, there's different types of nose jobs. Then within the different types, there's different specialists within the types of nose jobs.
Wow.
I would say you could break a nose job into like 10 different surgeons depending on your need. And nobody realizes that.
I have no idea.
Right. And the average plastic surgeon does nose jobs, boobs, butts, and lipo. Right. It's like, forget it. And so for the consumer, I think that's the hard part. They never even understand that. We as physicians barely understood that, So that's one thing that I have made a point from my practice to be super ethical and super honest with my patients and just guide them like I would my sister or my brother. How if my dad came in and asked for advice, what would I tell him? I wouldn't try to sell him to make $10,000. I would give them the true, honest opinion. So I think that is kind of the ethical appeal that I appreciate about your practice too, that we're just trying to help people in a deeper way. And that's the goal of this podcast. And we hope everyone listening kind of appreciates that the advice we're going to give and what we're going to talk about is going to be really ethical, really honest, and just try to give you real modern prescription on day-to-day life and how to balance the things that we all deal with.
I hope we can help someone.
Yeah.
Let's see.
So let's jump into it. So tell me, Jeff, right now, I saw an article today that I was super curious about, and I want to get your advice. Dexamethasone for coronavirus. What's the deal?
So obviously, the coronavirus is back in the news because the case numbers are picking up. I think given things opening up, restaurants opening, and then compounding that with people in close quarters, from all these wonderful protests that we've been seeing.
But can I ask you, so if you're going to a restaurant, so as a doctor, what would you, I'm a 40-year-old guy who has 2 kids and a wife, and I want to take my kids to Applebee's this Friday.
Yeah.
What would you tell me to do?
Well, there's no such thing as 100% safe. I think there's no such thing as zero risk.
Okay.
And so if you are in a group of people that has been only in your house, for example, and you go to a restaurant and you're wearing masks to your table and sit down and are separate from everyone, it's a low risk thing, but not a zero risk thing. So the thing about coronavirus that's so unique is it really picks on the weak. And if you are young and healthy, you're gonna probably be fine if you get it. So they put on the news to scare people the example of the one 34-year-old who got really sick.
Yeah.
But the truth is that's 1 in 10,000, 1 in 100,000.
So you don't think the average healthy 34-year-old should be worried?
Well, They should be worried about getting it and giving it to loved ones that are older and at risk.
Got it.
But they themselves will not be at super high risk.
Got it.
So if 1 in 100, let's say 1 in 10 to 100,000 young people who get it are really sick, that's about as likely as they are to get in a massive car accident in a given year, or all these other things that we take for granted.
Yeah, very true.
So, but the scary thing is giving it to the at-risk people, because if you're a diabetic, if you're over 70, then this is a really, really dangerous disease.
Yeah.
So the news that came out was about this medication called dexamethasone, which is basically a steroid, something that lowers the immune system.
Should we all be taking that now? Should we all go get it?
So that's that's a really bad idea. So just like we found out with hydroxychloroquine, which ended up not being helpful, this is a little different. We think this helps, but what it helps do is prevent that really severe cytokine storm, which leads to people needing to be on the ventilator, or helps stop that and get people off the ventilator. This is a steroid. So what it's doing is it's lowering your immune system. So if you have a very mild case and then take dexamethasone, you may end up getting some other infection. It causes your sugars to rise, blood pressure to rise. There's all these side effects.
Wow.
So it's a Hail Mary that's worth it if you're really sick.
Got it.
But it's not something that everyone should be taking at all.
So basically, this is only for really sick patients already in the hospital, already intubated. This is not to be used at home. This is not to be used preventatively.
Not to be used preventatively. Definitely only in the hospital.
Got it. And that's the hard part with the news cycles. One thing we both notice is when you watch the news, everything's sensationalized because they want viewership. It's not about releasing content.
Yes.
It's about viewership.
Yeah. So that's the thing. When they, on CNN, for example, they have the ticker, how many total people infected.
Yeah.
But what they never really, do you know offhand, how often they show what's the percentage of people in a certain age group that end up in the hospital, aged 30 to 40. Do you know that?
I don't. No.
It's 0.001%.
Wow.
But they don't say that.
Wow.
They want everyone to be scared and watching.
And keep watching. And that's what we're hoping to do here, is to give you guys actual tidbits and advice without the sensationalism. Just what you need to know.
How have you found that this whole thing changed your practice?
Oh man, I would say the biggest thing that I and all of us, the whole country's finding out, the whole world's finding out, is that you can interact with your physicians by telemedicine.
Yeah.
I think telemedicine was kind of this elite luxury thing that we used to think about, and we didn't really use it as a daily option. And now we realize that you can truly help your patients and take care of them on a daily basis through telemedicine. We're using a lot more of it. I've never done more telemedicine consults in the past 2 months than I ever have in my entire career.
I totally agree. It's so funny that the way Medicare pays doctors is the patient has to physically step foot, or it used to be they had to physically step foot in your office, and you had to examine them, and that was part of Medicare giving you your $100 for the visit.
So without physically seeing them and touching the patient, you can't get paid.
No. So if a patient calls you, even if they call you at 9 p.m. and you spend an hour on the phone, that was not billable.
Yeah.
But if they physically come into your office for 4 minutes and you step in the room and wave at them and run away, that was billable.
Got it.
But what we've come to it's been amazing, because now Medicare, one of the very few smart things they did during the pandemic was start to pay for telehealth.
Wow.
And so now, all of these things where if you're an 85-year-old and it's hard to, you don't drive anymore and you need to, all of these things that were so basic, if you just need to call them to go make sure that they have their blood pressure pills, all of these basic things that there was no need for them to come to the office for, those have been now, it's going to change everything forever.
Yeah.
What I've done to make it even easier is now I'm doing a lot of telehealth paired with my nurses making house calls to do the blood work.
That's fantastic.
So what we're doing for a lot of people, let's say you're a diabetic, you don't really need to be examined per se, but I need to see what your sugars are doing, what's your A1C, all of these, check your urine, make sure there's no protein in the urine, all of these things. And so normally it would be come to the office every 3 months.
Right.
But really I just need the numbers. So,
and we're talking about asymptomatic patients who are just managing chronic diseases.
So I'm not talking about, coronavirus too, I'm doing virtually, because it's too risky to have people in the office to infect my staff and myself.
Of course.
But I'm talking about just routine medical care. It should be a lot of it virtual. It should have always been.
Right. And that's so interesting that we're just finding that out. And now there's so many platforms that are just exploding from Zoom, Doxy.me. Which one do you guys use?
I actually I have my own and integrated with your website.
Okay,
so when someone books, it sends them the link and then it goes straight into the visit.
Perfect. Yes, we have the similar system integration. Ours integrates with Zoom.
Gotcha.
And for me, the reason we love Zoom is because with Zoom, you can share your screen.
Okay.
And so when I'm doing my consults, for me, it's very important to be able to share my screen because then I can morph the photos. I can look at their photos with them. Wow. I can show them other patients' photos. And so I share my screen and it's a really cool interactive experience. So it's almost like they're getting the in-person consultation.
This is a really weird question. Why on Zoom does it make your chin look bad and your nose look bad?
That's a great question. So there's a study that showed that people are starting to get more cognizant of their double chin, more cognizant of the way they look because of Zoom. You're right. It's kind of like the Snapchat dysmorphia that we all talked about 3-4 years ago.
Yeah.
And so now we're seeing it with Zoom. And it's not just, 18-year-old females now, or even 40-year-old professionals, men are seeing this
I've never
too.
stared at my face this much.
Exactly. That's the problem. We're staring at our face and in a weird angle because we never look at ourselves from an inferior looking up angle.
Yeah.
And so when we look in the mirror, we're usually face to face.
Right.
When we take photos, we usually, it's usually angled in some upper to lower way where we look skinnier, we look thinner.
I like that.
Yeah, I like that. Who doesn't want to look skinnier? But I think now with the Zoom, your camera's inferior to your face, you're looking down, so it's an automatic double chin. But I think this is, part of everyone needs to remember, just because you see yourself in weird angles doesn't mean the rest of the world sees us like that, And so don't get insecure, don't get bothered by this new vision of yourself that's not real. It's just a perception that Zoom's created for us. Yeah. But it's a good one. A lot of people have that concept right now. A lot of people. So tell me, in terms of your practice right now, what are the top 2 or 3 things that you're getting blown up about? So,
obviously one of the main things right now is coronavirus testing as things are opening.
So let's talk about testing.
So a lot of my clients are either CEOs of businesses or work in film industry in LA here.
Okay.
So they're having productions are going to start in the next month or whatever.
Yeah, I saw that productions are starting.
So we are attempting to protect with these sets basically.
Yeah.
And so that means you think of it being just the talent. So it's like, a couple characters, but no, like
Brad Pitt needs to get tested.
Brad Pitt has 50 people on the set that are the makeup or the sound, the boom guy, the guy, the cameraman.
Wow.
So you have to really test. We're figuring it out as we go, but essentially everyone needs to get tested on somewhat of a regular basis. The talent who can't wear masks on the set probably need testing most frequently because they're all next to each other.
Got it.
And if one of them gets sick, that disrupts the whole thing. Whereas one cameraman gets it, they may be able to just shut down temporarily, test everyone, and if everyone's negative,
continue.
Cameraman and continue.
It's like what we saw with the meat processing plants and how a couple of people get sick, everyone's sick all of a sudden, then they have to shut down for a month. And so you're trying to avoid that. And with the testing, are you guys doing swabs or the antibody tests?
It's a great question. So my quick spiel.
And what is a swab? What is an antibody test? What was the difference?
Yeah. So the virus causes an infection, obviously. And so in the early stages of an infection, even a lot of times before you have symptoms, if we stick a swab either all the way up the nose, you can tell me exactly where we're going, but somewhere up there that I can't see, or in the back of the throat, we can pick up pieces of the virus. That's called a PCR swab.
Yeah.
So that is the test to find out, are you actively infected and are you contagious to other people?
Yeah. And the area that they're poking is in the back of the nose called the adenoid pad. When we were kids, that was the little pad that used to cause a lot of kids to have a bunch of sinus infections and stuffy noses and runny noses. So we used to actually shave the adenoid pads out. But as adults, that adenoid pad still stands as a reservoir for infection. And so that's where you guys are swabbing in the back of the nasopharynx, the back of the oropharynx, where that pad is, and getting the PCR. Right. So what happens after you swab?
So swab is collected.
Yeah.
We send it to our lab. We get results in about 24 hours.
24 hours? Yeah. That's fast.
You will get an email with results in 24 hours.
Wow. It used to be like 5 to 7 days.
The beginning, it was terrible.
Why was it so slow and now so fast?
Because at the beginning, there weren't enough labs that had the machines.
And
because this is a brand new virus.
Got it.
So, slowly but surely more labs have it, private labs have it. So I have a relationship with a private lab that has one of these new machines.
Wow.
And since we're sending them a lot of tests, they're basically getting us results next day.
Wow. And you started a new company just to do this test to accommodate the volume, right?
The problem, it was actually sort of by accident. Basically, my office was getting so many calls about coronavirus.
Yeah.
Just referred from patients or whatever. Like my normal office staff who's used to filling people's medications and
just overloaded.
So initially it was just a person out of the office picking up the phones, but then it morphed into we needed more nurses, and then it morphed into we needed a lot more nurses, and so now I just made it a separate company.
Wow, amazing! Yeah. And so now you're sending the nurses.
So we send the nurses to your home, to your office, to anywhere you need. We can set up drive-throughs for you. Basically, some of these days we're testing 50, 80 people in a row. So we'll do either a drive-through.
What's a drive-through test for someone who's never heard of that?
So the nurse is sitting basically at a table and the cars just drive by one, and she walks up to the window, swabs you, makes sure the name matches up on the tube, and then drive off. So it takes like 2 minutes a person.
And the nurse is doing the nasal swabbing or the oral swabbing?
I think the nasal is slightly more sensitive.
Okay, got it.
So that's the one preferred, but some people have phobias against it. So I'm willing to do the oral pharyngeal one if we have to.
Got it. Yeah, because I did the LA free testing drive-through.
Yeah.
Me and all my staff, before we went back to work, we all just went to get, and also to experience it because we're going to tell patients to. And they give you a little cassette that you break in your car. Self-swab. And you just swab the back of your throat, and they kind of give you directions how to like kind of gag yourself in the back and then in the sides, the tonsillar areas. Yeah. And then you stick it in the thing, drive off, throw in a little bucket, and you drive off. And then I got my results in about 2 to 3 days. And so I think that's pretty cool. But I think being able to get the results in 1 day, and especially from a much, not that LA is not reliable, but a much more controlled setting from a doctor's office just seems so much better.
I've had people who went to the drive-thru and then they wanted the results, couldn't get them. We're calling. It takes a while.
There's a lot of bureaucracy. Yeah, it's a big system. So I think what you're doing is a phenomenal.
So that's been great. And then we do the antibody testing too.
Yeah.
There's so much confusion about the antibody testing.
Yeah. So, okay. What is an antibody?
So first of all, when you get an infection, as your body is getting rid of it, one of the ways we get rid of any infection is your body makes antibodies. So that's first of all what an antibody is. This starts to happen on day, let's say 3 to 4 of an infection. We'll start to see some antibodies. And there's 2 types of antibodies, something called an IgM antibody, which is like the early stage antibodies. And then there's mature antibodies called IgG that start maybe like 7 days out. And so the antibody test is asking a different question. It's asking the question, were you exposed to corona in the past, and are you currently making antibodies to it? So these companies, there's actually companies out there that are doing these rapid finger prick antibody tests as like a COVID test.
Yes.
Do not do these. These are fake. These are bad.
That's a great question, because I've seen so many influencers posting in the past month that they got their at-home COVID test from a doctor who comes to their house, and it's just an antibody finger prick.
The problem is, if you are in day 0 to 7 of your infection, you could have a false negative, but still be infectious to other people.
Because it's not testing if you have coronavirus. It's testing if you were exposed in the past. And that may not be mature enough to show yet.
Yes. So there's like this huge window where it's useless. So for the non-sketchy doctors selling the test, what that test is meant for, so that people understand if that test doesn't work, why does it exist?
Yes.
Just to be clear is, in other countries like China, Korea, if on a population level, you're testing everyone going into a train station, everyone going into an office building, if that test helps you pick up a few IgM positives that you then quarantine, it lowers the spread in the community. So it overall will bring down the total number of cases in the community, but it is by no means safely telling you as an individual that you don't have it. So you're catching some, but not all.
Got it.
So it's better than nothing as a major, because they're cheap.
Yeah.
Like if the government wanted to test everyone from now on getting on a bus, they would catch people.
Yeah.
Some people would be IgM positive.
Which means that they actively are making antibodies, which means they recently had the infection, or maybe still do.
Right.
Got it. And so IgM means you currently are making antibodies. Yeah. IgG means at some point you had it.
In the past.
It could be historically.
Anytime long, it was at least 7 days ago, but could have been
months ago. Okay, so now if let's say I have IgG, the mature one that means you had it. Am I good to go? Can I run around without a mask?
So because this is a new virus, we don't know how long the immunity lasts for. Mm-hmm. And so they're studying this, really carefully.
Got it.
So they can actually not only say antibodies, yes or no, they can also quantify like what's your titer, how many antibodies do you have?
Interesting.
And so you're likelier to have longer term immunity if your titers are higher.
Yeah.
Nobody so far has any correlation between if you're sicker, do I have more antibodies? That's not a thing. No, there's no correlation between if I was asymptomatic, do I not have antibodies? That's not a thing either. So it's all yet, because it's a new virus, it's yet to be determined.
Got it.
For the other, the reason we're calling this thing COVID-19 is there's other coronaviruses that have been, that usually cause the common cold. For those coronaviruses, antibodies typically last 1 to 2 years. So that's why you're able to get the common cold more than once.
Got it.
So it may
just like we have to do the flu vaccine every year.
Yeah. So the flu mutates a lot more than most other viruses. And that's part of why, despite the fact that it makes a lot of people sick, there's no vaccine that's just wiped it off the face of the earth. Because what's weird to think about, we're too young to have gone through this, but we learned in medical school about polio, about smallpox, all these things that were devastating.
Right.
That, it's funny, I have some older patients, and like these guys in their 80s come in and they'll tell me about when they were kids and they would go to summer camp, there would always be like 1 or 2 kids that would come back with polio. And I was like, oh my God.
That's so scary. Yeah. Because that'll be interesting to see what happens now, because now kids are going back to school. Yeah. I have my nephews going to school, and it's going to be interesting to see what happens. Is this going to become a thing for the kids or not? So far, it looks like kids are pretty safe, right?
They're pretty, I'm not a pediatrician, in my caveat, so I'm less informed in this area, but my understanding is there are some severe cases for sure. There's some weird vascular things that can happen. This like COVID toes thing you may have seen on the news.
Yeah.
But they're relative to like the rest of the population, much safer.
So you would say, generally speaking, that's more sensationalized case reports. Yes. It's not something the general public needs to worry about.
I mean, it when it's your kid, it's hard to say.
That's true.
So it's like, if it's 1 in 10,000 or 1 in 100,000, we all, it's this is really like ask the question to a lot of us: how much risk are you willing to take on as a human? So some of us drive faster, some of us do extreme sports, some of us rock climb, and other people don't.
So exactly.
Other people like to play video games because it's safer.
Right.
So because I have patients ask me, hey, is it safe to go do this or that? And I say, I can't, that's really like I can say that it's not zero risk to do something, but I can't say whether you should do it or not, because it's up to your risk tolerance.
One thing I get asked a lot is, do I have to wear a mask? And what I always tell patients and what I tell friends and family is that you're not wearing the mask for yourself. You're wearing the mask for everyone else around you.
Right.
When you are concerned about getting sick yourself, then it's totally a different story. Then we all selfishly do everything we can to protect ourselves as a human species. We're built for survival. That's how we were designed. But when you think about the mask, it's not about what you're going to prevent yourself from getting. It's what you're going to prevent from giving to everyone else. And I think that's totally been misunderstood by the general public, because everyone thinks, 3-ply mask and N95, it only filters 95%. So what's the point of wearing it if you can still get it? It's not for you.
It's both.
Yeah, it's both. And I think a lot of people miss that part of it.
So because when I see patients, I basically have them keep their mask on, for the most part. Yeah. What are you, obviously you're examining people's noses.
Yeah, exactly. So, for us, it's a little different. We test every patient before they come in for surgery. Really? A lot of my surgery patients have been coming to you. A lot of them come to you and get tested. So before surgery, we mandate everyone get tested. And that's kind of the standard.
What about before like a consult?
Yeah, so before consult, just coming to the clinic, basically 3-4 things. So one, we temperature scan everyone, just like you would at a restaurant. We also make them all go through a COVID waiver, basically stating that they haven't had a positive test in the past 21 days. They have not had any exposure to anyone positive with COVID. They themselves have had no symptoms. And basically they sign all like 15 different things, make sure. And then if they pass all those check marks, then they're allowed to come to the clinic. And so we are pretty prepared. And then one thing we always do is just like, the same concept about masks protecting and yourself and the other people around you. So when the patient removes their mask, I always have mine on.
Right.
And then when the patient puts their mask back on, then they're protected again.
Right.
So the patient's always well protected. And also it's a one-on-one environment for most doctors' offices, so it's not like you're going to a concert and you have to worry about 50 people, someone coughing on everyone.
Right.
It's one-to-one. And so all the staff, everyone's very well protected, wearing masks. So the patients feel pretty comfortable now, but we're just starting, it's still a very slow startup for us because COVID precautions and just being safe and making sure that we're being responsible is the most important for our type of practice. But there are people doing novel type of things. There are people doing some weird things like the drive-through thing that we were mentioning earlier.
Oh my God. Yeah. So this was interesting. We were reading an article about someone, they're a plastic surgeon. Right?
Plastic surgeon.
They were sitting in a line to wait for their drive-through COVID test and had the idea of setting up a drive-through botox.
Yes. Drive-through botox. Yeah, I saw that. I think that's so interesting. I think it was in Miami.
Yeah.
And I think it's so interesting. Yeah, of course, it's Miami.
Where else would it be?
yeah. It's not going to be in Kentucky.
You need the botox quickly before you go out at night.
I know. Now that you can go out to dinner, what are you going to do? Yeah. So I think that's hilarious. And I think it's obviously just a marketing gimmick. No one's actually doing that. And that's not a real thing. He's just doing that for sensationalism. And it makes a fun article and he got published and people talk about it. And it's great. It's just good marketing. But there's no way because, doing a COVID test or getting a flu vaccine through a drive-through is one thing. Botox is a whole artistic approach.
Well, that's you have a artistic approach, aren't there? Because I drive around sometimes and I see these. It's an urgent care. It literally is an urgent care in a strip mall.
Yes,
and it'll say we have labs, we have X-rays, we have Botox.
Yeah, I see that all the time.
Yeah,
it's so funny. I think that's so bizarre because I think that when you look at medicine as a consumer right now, you're listening to this right now. You have to think about. Is your best interest at stake or is their best interest at stake? And that's always, a battle. And the goal should be that it's kind of even.
Both.
Right? It should be both.
Yeah.
But if it's really leaning one way or the other, you should be a little worried. And so I think a lot of these strip mall doctors, practices, emergency, I have friends who own like 6 urgent cares and it makes no sense to me because they're just businessmen. Right. I don't think they really go to sleep at night worrying about their patients the way we do.
Right.
But I think that is usually a flag and a red sign that they're probably not offering the best service.
Do you do Botox also?
Yeah. So I do noses and injectables, and then I have nurses as well who help with the injectables. But injectables I love to do because it's really an artistic approach to kind of painting a face long-term is how we talk about it. So we look at the face of the painting, and you can't finish a painting in a day. I have a lot of patients who come and they will say, hey, I want my lips done, my cheeks done, and I want my Botox. Right. And what I tell them is, whoa, slow down.
Yeah.
The face is a painting. You cannot finish a painting in a day. It took Rembrandt years sometimes to finish one painting.
Right.
So you have to look at it very carefully, very slowly. We're here to finesse and enhance the painting. Right. We're not here to change it. And so I will do small brush strokes at a time, a little bit of Botox, come back, a little bit of lips, come back, a little bit of cheek.
Because when you make a change, it makes it something else may not, that they think needs something change, may not want to change one thing.
Totally. Yeah. And I think that's the biggest part is that people really underappreciate themselves in today's social media world because we're all staring at these filters and staring at these perfectly photoshopped edited photos and it makes us feel bad.
Right.
Even as guys, you look at these photoshopped guys with like 18 packs and it just looks ridiculous. It's like these guys have never had a cheeseburger ever.
Yeah.
Like, I don't understand.
I remember when I had that, I think I was like 15 years old.
When your metabolism naturally got rid of everything. Yeah, but it's tough. So I think the industry standards are kind of making people feel more insecure about themselves than they need to. And I think it's our job as doctors to be ethical and remind them of, that they don't need as much as they think.
Has the injectable stuff changed? I've noticed being out and around and stuff that the injectable stuff in the last couple of years has been more, at least to me, maybe I just am noticing it more. Yeah. Is that more where people are going?
Totally.
Like lips?
Oh man, totally. It's growing huge. And I'll tell you why it's growing so big. It's because the doctor himself doesn't have to do it. So you can now relegate this to nurses, PAs, NPs, depending on the state you live in. Every state's different in America.
Right.
And depending on the country you live in, some countries, hair salons could do them.
But I'm sure some of your patients want you to do it.
Of course. So there's different tiers. So, there's customers who buy bags at Target. There's customers who buy bags at Chanel, and there's customers who buy bags at Hermes.
Right.
So every customer is a little different. And so, there's some who want doctors. And within doctors, there's the pediatrician who does it. There's the internal medicine and primary care. Who, how many of your colleagues do Botox?
I know.
Yeah. And then there's dermatologists, and then there's plastic surgeons. And then, so there's different tiers and different levels of training. But end of the day, it's really about finding someone who does a lot of anything.
Right.
End of the day, whatever it is, there's tons of nurses who are so good at Botox,
of course.
and there's tons of doctors who are terrible.
There's nothing about being a doctor that necessarily makes you better at doing Botox.
Totally. You would think
it's its own form.
Yeah, you would think the only thing is that it's the ethical approach to it.
Yeah.
Because being a doctor, you went through so much training, your ethics should be a little higher.
I guess so.
But not every doctor has that ethical approach, unfortunately.
I don't think so.
And so as a consumer, what I would say if you're looking to ever do Botox or fillers is you want someone who does a lot of it. It doesn't really matter what their training is, as long as they're, of course, board certified as a physician or a nurse, whatever they are, that they have the appropriate training. But you want someone who does a lot of it and has the look that you like. Because there are some people who do this overly done plastic look.
Yeah.
And
but some people want that.
Yeah, and that's great. And if you want that, then that's your match.
Right.
And if you want a more natural, conservative doctor or nurse, then there will be plenty of those for you also. So it's finding someone who has your look and has the skill and expertise and does enough of it.
Do you find that there's a lot of quote unquote plastic surgeons who really aren't board certified plastic surgeons? There are, aren't there?
Yeah, there are. And what it is that it's not that they're not surgeons. It's that being board certified in the field of plastic surgery usually only means you came from 2 or 3 different lineages.
Right.
One is general plastic surgery, which means you did a plastic surgery residency.
Right.
One is you did otolaryngology, ear, nose, and throat facial plastic surgery, and then a facial plastic surgery specialty afterwards.
Right.
Or you did some other type of oculoplastic training where you're an eye surgeon who then specializes in oculoplastics.
Right.
But then there's this other niche of what's called aesthetic surgery.
Right.
And aesthetic surgery means you do anything you want aesthetically. And there's no real training. There's no real licenses.
Right.
So there's dermatologists today who do liposuction.
Right.
There's primary care doctors who are doing, facelifts.
Right.
I know a primary care doctor who does facelifts, and he's claims to be quite good at them. I don't know. I've never seen him operate, but I wouldn't trust a primary care doctor to do my facelift. But there's a lot of people, and it's aesthetic medicine.
It goes against, like, for me, I would never do any cosmetic stuff in my office because the whole thing is it's about feeling good, well, like,
yes,
and people shouldn't be coming to their doctor who's making them their medical doctor to talk about like what they look like. And, like, I mean, yes, people listen, they should be sent to someone who can help them with that.
Of course.
But I just think it crosses a line between, there's something, I don't know. It makes me uncomfortable.
No, totally. I understand. And I think that's where you, being an ethical physician who looks at your patients and their well-being as a whole with the holistic approach you take versus being a businessman who tries to really capitalize on his patients. And I think that's the hard part for patients to understand. Is my doctor a businessman or is he ethical? Yeah. And sometimes it's both, which is fine. But the ethical part is what you really want to hone in on as a patient when you're looking for your doctors. You want ethical, you want honest, and I think that goes back to the old approach. How do patients know?
How do they find people?
Yeah, that's a tough one. How do patients know how to find a good doctor? That's a great question in today's world, especially now that we're all doing online virtual consults. You can do it with anyone, right? I think one is definitely,
you got to ask your internist.
You got to ask your internist. Yeah. No, you're absolutely right.
But a lot of times, that's the problem. Is a lot of time I was saying how I see my own patients in the hospital. So when my patients are sick, they have pneumonia, they have a heart attack, they have a stroke, I'm there treating them with the specialist. So I know who's a good consultant.
Specialist. Yes, exactly.
Because I work with them.
Right.
And I'm talking to the patients about the active care constantly.
Exactly.
So it's way different than, people will sometimes sort of like text me, hey, I heard this so-and-so is a good doctor. Should I see them? But I don't know, without knowing them personally.
Yeah, it's hard for you to refer.
It's hard. Just because someone has seen, let's say a celebrity for a knee surgery. I don't know that they're a good knee surgeon. I've never,
right,
if I don't,
right.
If I haven't seen dozens of their patients.
Totally. And also like the celebrity thing's a great thing you brought up because, being in LA and for both of us being in Century City, Beverly Hills, we have access to so many celebrity patients. Yeah. And one thing that I've noticed, and I'm sure you have too, is that you have to always take the celebrity endorsements with a grain of salt because you don't know what they got out of it. Yeah. You don't know what the back end was.
Yeah. And what we mean by that is anything ranging from free care to getting paid to get the surgery,
to taking care of their mom, for a numerous number of reasons. Mostly some sort of financial gain is in it. There's very few reasons a celebrity will post about a doctor without a financial incentive.
100%.
And I think
it's weird. It's funny because in other, like if you have a clothing brand, if you have, streetwear, if you have a juice that you make, whatever, people will, want to post their celeb clients or celeb whatever.
Yeah.
I feel uncomfortable. So like I never ever.
Well, we're not allowed to.
I mean, well, that too.
Yeah.
But I would never ask like, hey, do you want to?
Right.
Sometimes they will ask.
Yeah.
Occasionally.
Yeah.
But I would never even think of doing that. It's
right. It
makes me uncomfortable.
But that's I think for the patients, it's like really important to when you see that because sometimes you'll see it. We even see it sometimes. We're like, oh man, that must be the best orthopedic surgeon. Yeah. And you have to remember, it's take it with a grain of salt. Yeah. You may not mean anything. It may just be a really clever endorsement that was well crafted and well placed.
Yeah.
Great. Well, I think we thank you all for joining us today, and I think Dr. Toll and I both really appreciate you guys being here and listening and.
Hopefully something made sense. I don't know.
Yeah, exactly. Because this is our form of a modern prescription. We really want to just give you what's needed instead of just what makes you stay here as a viewer and pay for ads.
Well, we like ads.
Yeah, we like ads too, of course. But yeah, we thank you for being here. Thank you for listening. And we want you to stay tuned because next week we're going to be talking about really what's really important for all of us right now, which is mental health and staying out of the negative news cycle. I think there's so much negative energy right now. Anytime you turn on your TV or your Instagram or your social media, how do you keep yourself in a balanced, happy place and realize that there's a lot of good happening in the world despite all the bad that is definitely happening. So stay tuned. Next week, Dr. Toll and myself, Dr. Dugar, will go into the depths of what we do personally, what we prescribe for our patients, and what modern prescription you should take on yourself.
Thanks, guys.
Thanks, guys.